Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Dwarfism, short stature. Achondroplasia is a genetic disorder that causes dwarfism, short stature. It is a disorder in which bone and cartilage do not grow normally. It is the most common cause of dwarfism. Ayurveda describes 8 conditions under the heading Osteoninachia. Dwarfism is one among these conditions. These conditions are to be treated with special care, hence this specific category. Achondroplasia leads to patients attaining a full-grown height of less than 4 feet. The greatest shortening occurs in the humerus, the bone between the shoulder and the elbow, and the femur, the bone between the hip and the knee. There may also be underdevelopment of the face. Achondroplasia is the most common form of inherited disproportionate short stature. It occurs in 1 in 15,000 to 1 in 40,000 live births. Causes: achondroplasia is a genetic disorder. It is caused by mutations in the FGFR3 gene that inhibits growth of cartilage at the growth plate. The result is that the growth of bones, which normally occurs in the cartilage of the growth plate, is slowed. This leads to shorter bones, abnormally shaped bones, and shorter stature. The gene for achondroplasia can be passed from one generation to the next. If a parent has the disorder, there is a 50% chance of passing the gene for achondroplasia onto offspring, autosomal dominant inheritance. In most cases of achondroplasia, 80 to 90%, it more commonly is the result of a spontaneous mutation, a sudden genetic defect, that occurs in the developing embryo. Risk factors. A risk factor is something that increases your chances of getting a disease or condition. Those at risk of inheriting achondroplasia are children of a parent with achondroplasia, children of normal-sized parents who carry a mutated FGFR3 gene, advanced paternal age causing spontaneous mutations. Symptoms: patients with achondroplasia have short stature, a long trunk, and shortened limbs, which are noticeable at birth. Adults usually reach a height of between 42 and 56 inches. The head is large and the forehead is prominent. Portions of the face can be underdeveloped. At birth, the legs appear straight, but as a child begins to walk, he or she develops a knock knee or bowed leg deformity. The hands and the feet appear large, but the fingers and toes are short and stubby. Straightening of the arm at the elbow may be restricted, but usually does not keep a patient with achondroplasia from doing any specific activities. Children may develop an excessive curve of the lower back and a waddling walking pattern. Other common symptoms include weight control problems, bowed legs, middle ear infections, especially in children. If not treated properly, can result in hearing loss. Dental problems, from overcrowding of teeth. Hydrocephalus, water on the brain. Neurologic and respiratory problems. Spinal compression. Fatigue, pain, and numbness in the lower back and spine. People with achondroplasia are generally of normal intelligence. Other than short stature, their overall development is usually normal. However, children often take longer to develop normal motor skills. Diagnosis. Diagnosis includes clinical evaluation, radiographs. Molecular genetic testing can be used to detect a mutation in the FGFR3 gene, chromosome locus 4p16.3. Such testing is 99% sensitive and is available in clinical laboratories. A doctor can usually diagnose the disorder in a newborn from observation of physical symptoms. To confirm that dwarfism is caused by achondroplasia, X-rays are taken. It is important to follow the case to make sure that spinal stenosis does not develop. The strength of the extremities and bladder control are to be evaluated. Weakness and loss of bladder control are both signs of developing spinal stenosis. Ayurvedic treatment. Ayurvedic medical treatment along with Panchakarma can provide great relief and improve quality of life. The prognosis depends on the severity of the disease. Patients who have 2 copies of the deficient gene, that is one from each parent, also known as homozygous, generally die a few weeks to months after birth. Those with 1 copy, that is from only one parent, also known as heterozygous, have a normal lifespan and intelligence, although there is an increased risk of death in the first year of life due to respiratory problems. They are usually independent in their daily life activities. Many of these patients, in fact, have gone on to do great things in life.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.